What are the common types of bladder cancer? Imagine your bladder as a balloon-shaped organ that stores urine, and inside its lining are special cells called urothelial cells. The most common type of bladder cancer starts in these cells, known as urothelial carcinoma or transitional cell carcinoma. This type makes up about 90% of all bladder cancer cases. It begins in the lining of the bladder and can grow in different ways. Bladder cancers are often classified based on how deeply they invade the bladder wall. The first group is called non-muscle-invasive bladder cancer, which stays confined to the inner lining or just beneath it. This makes up around 80% of bladder cancer diagnoses. Within this group, there are several subtypes. One is papillary bladder cancer, which appears as finger-like growths that protrude into the bladder's hollow space. These are usually low-grade, meaning they tend to grow slowly and are less likely to spread, and can often be removed with surgery. Another subtype is carcinoma in situ, or CIS, which looks like flat, red, velvety patches on the bladder lining. CIS is considered high-grade and more aggressive, with a higher chance of recurring or progressing to more invasive disease. Then there are T1 tumors, which have grown beyond the lining into the connective tissue underneath but haven't yet reached the muscle layer. High-grade T1 tumors can be quite aggressive and often need careful treatment. The second major category is muscle-invasive bladder cancer. This type has penetrated into the muscle layer of the bladder wall. Because it has a higher chance of spreading beyond the bladder, it usually requires more intensive treatment, such as surgery or chemotherapy. When cancer spreads beyond the bladder to other parts of the body, it is called metastatic bladder cancer. This can involve lymph nodes, bones, lungs, or liver, and may be present at diagnosis or develop later. Besides urothelial carcinoma, there are less common types of bladder cancer. Squamous cell carcinoma can develop from squamous cells that form in response to chronic irritation or infection in the bladder. Adenocarcinoma originates from glandular cells in the bladder lining. Rare types like small cell carcinoma tend to be more aggressive and are less frequently seen. In summary, the most common form of bladder cancer is urothelial carcinoma, which is classified by how deeply it invades the bladder wall. Non-muscle invasive types, including papillary tumors and carcinoma in situ, tend to be less aggressive but requiring monitoring. Muscle-invasive and metastatic cancers are more serious and often need more aggressive treatment. Less common types exist but are rare compared to urothelial carcinoma. If you have concerns or symptoms related to bladder health, always consult a healthcare professional for personalized advice and diagnosis.